Hi, my name's Rachel and I'm one of the Access teachers. Welcome to your taster lesson on the Access to Higher Education diploma. I'm going to talk to you a little bit about the course and what to expect, and then we'll do a mini lesson on one of the topics that you'll be studying in the Access course. So the Access to Higher Education diploma is a one-year course that prepares you for university study. It includes 3 academic subjects: human physiology, psychology, and professional healthcare practice, or PHP. And there's also a study skills module. And I'll tell you a bit more about each of those in a little while. So about the course here at Richard Taunton, everybody studies the same subjects, but you choose which of 2 diplomas you're certificated in, and that depends on your career aim. So if you want to go on and do nursing or be a midwife, then you choose nursing and midwifery. And if you have any other sort of career aims, such as physiotherapy, being a radiographer, being a social worker, all sorts of other things. We've had students go on to do psychology, biomedicine, microbiology. All of those, it would probably be more appropriate to choose the health and social care certification. So make sure when you enrol that you know which of the 2 diplomas that is most suitable for what you want to go ahead and do. In terms of assessment, most of it's by written coursework. And there's also one research project where you research what other people have done in that field, and then you design your own research project and then carry it out and write it up and present your results to the rest of the class. And that is in psychology. And there are 2 exams at the end of the year in June, one in human physiology and one in psychology. You can see in the picture the library. So that is fully accessible and open for you to use during the daytime, and it's a great place to work. So about the course, I thought it would be useful to tell you a little bit about the assignments and the way that they're graded. So assignments and exams are either graded pass, merit or distinction, and they're either worth 3 or 6 credits. There's an introductory unit in each of the 3 academic subjects, so psychology, human physiology and PHP, which is ungraded. And that's really good because that means that you can get the hang of your study skills, get the hang of how to write and how to research and how the mark schemes work and what sort of quality is expected before you actually get graded on anything. You still have to do them, they're still compulsory, but they allow you to have a fairly gentle introduction to the course. The study skills modules are also ungraded. Everything is compulsory, so all the units that you do, you have to do them, and you have to achieve at least a pass in all of the graded units, and you have to get an achieve in all of the ungraded units. And then depending on your chosen degree course and where you want to study it, entry requirements can be very high. So midwifery at Southampton needs 39 distinctions and 6 merits as a minimum. And there's only 45 graded credits. Okay, and there have been students quite recently who have been asked to get 45 distinctions out of 45. So it's really important to be aware of the entry requirements for the course that you want to go on and do at university, but also start out the course with really high expectations of yourself, and really from the outset aim to get distinctions for everything. And your teachers will be helping you with that and guiding you and showing you how you can do that. So don't worry about it. Just make sure that you have those high expectations for yourself because it's really important. So at Richard Taunton, there are 3 teachers, one each for the different 3 subjects. I'm Rachel, as I said, and I teach human physiology. And the picture there that you can see is the classroom where I teach that. So you can see it's a nice, bright science classroom, plenty of room. Paula teaches psychology, and she'll also teach you study skills, and she'll be your tutor. And Helen teaches professional healthcare practice. The lessons are on Tuesday evenings from 5 till 8, and that's where you'll do PHP. And all day on Wednesday, so a long day on Wednesday from 8:30 till 5. So typically I would do human physiology in the morning, and then Paula will do study skills and psychology and be available for doing tutor one-to-ones with you. So it is quite an intense period during the week, from Tuesday evening to Wednesday afternoon. But what that does mean is that it leaves the rest of the week for you to work and for your family commitments and things like that. So I'll just give you a brief rundown in terms of what all the different subjects involve. So psychology has the introduction to psychology, which is ungraded. You do a unit on treating disorders, which is 3 credits. You then do the psychological investigation, which is the research project, and that's worth 6 credits, so it's double weighted. And then the exam at the end of the year is also double weighted with 6 credits. So you can see that altogether that makes up 15 graded credits and 3 ungraded, and that's the same for each of the 3 subjects. Professional healthcare practice has the introduction to professional healthcare practice, which is ungraded. You then do a unit on mental health and well-being for 3 credits. The social and community welfare provision is double weighted at 6 credits. And that is the replacement. So in PHP, you don't have an exam. That one is the alternative assessment. So it kind of replaces the exam, but it's still a coursework unit. There's a module on health promotion, which is worth 3 credits. And then the final module is in effective communication in health and social work. And again, that's 3 credits. So again, 15 graded credits and 3 ungraded. And I seem to have lost human physiology. So I'll just see if I can skip back. There we are. Okay, so human physiology. So that's me teaching this. So we start off with the introduction to cell biology, which is actually a class exam. But it's ungraded. And then we have our first coursework unit, which is human reproductive biology, and that's worth 3 credits. We then do a unit on infectious disease, drug and biological defences, which is hugely relevant at the moment. That's worth 6 credits. And then the exam at the end of the year, aspects of human physiology, which looks at lots of different body systems and the way that they work together. And that is worth 6 credits as well. So again, 15 graded credits and 3 ungraded. Okay, so skip through those slides which you've seen already. And then finally, study skills. There are 2 different units in study skills. So one of them is called Preparing to Progress, and that's worth 3 credits. It's ungraded, as I said before. And that's got all sorts of different things. You build up a portfolio in that one. And it's things like an action plan for skills development. So you do an analysis of your own skills, a gap analysis, and then you develop an action plan for how you can develop any skills that you're lacking. You prepare a CV. You prepare your personal statement for your UCAS application for going to university. And you have the opportunity to prepare for and have a mock interview for university. Because in many of the areas that you're likely to be going to university, so nursing, midwifery, etc., you are likely to have an interview for that. So it's really helpful that you get that opportunity to do a mock interview in the course. The other part of study skills is called developing skills for studying. And again, that's 3 ungraded credits. And in that, you plan, deliver, and evaluate a presentation. So typically this year, students delivered a presentation on their psychology research project to the rest of the class. So you plan the presentation, give the presentation, and then you evaluate how it went. And you also learn about different reflective models, and you apply that to your presentation. And it also helps you with, or part of the developing skills for studying is learning about research skills, academic writing, and referencing. So it really backs up the work that you're doing elsewhere on the course. Okay, so that's the end of me talking about the course and what to expect. We're now going to dive a little bit into one of the human physiology units. As I said, infectious disease, drug and biological defences is a 6 credit unit. We only started doing it last year, but I'm really glad that we did, because obviously it's so relevant at the moment, and I'm sure it's a topic that everyone is really interested in. So what I'm going to do, I'm going to play you a short video about how to eradicate a disease. So I suggest you write brief notes or just listen and watch very carefully, because there will be some questions which will follow the video.
For most of human history, medical workers sought to treat diseases or cure them. The rise of vaccination in the 19th century enhanced the potential to prevent people from contracting illnesses in the first place. But only in recent decades did it become possible to ensure that a particular disease never threatens humanity again. The story of smallpox, the first and so far the only disease to be permanently eradicated from the world, shows how disease eradication can happen and why it is so difficult to achieve. Smallpox emerged in human populations thousands of years ago as a contagious virus that spread rapidly, primarily through close, face-to-face contact. Causing fever, aches, and rashes, it killed up to 30% of its victims and often left survivors with lifelong disfiguring scars. The devastating impact of smallpox was so great that several cultures had religious deities specifically dedicated to it. In the 20th century alone, it is estimated to have killed more than 300 million people worldwide. With the effective deployment of vaccination, the number of cases began to decrease. By seeking out infected individuals, isolating them, and vaccinating their contacts to prevent further transmission, scientists realized that the spread of the disease could be halted. In fact, because smallpox could only survive in human hosts, vaccinating all of an infected person's potential contacts would stop the virus dead in its tracks and eliminate it from that region. Once this strategy had succeeded in ridding most industrialized countries from the disease, health officials realized that eradicating it worldwide was within reach. But this was not an easy process, proving especially difficult in places suffering from poor infrastructure or civil wars. The eradication effort took decades and involved millions of people working together, from world leaders and international organizations to rural doctors and community workers. In India, one of the last strongholds of the disease, health workers visited every one of the country's 100 million households to search for cases. Through this unprecedented worldwide effort, in which even rival superpowers cooperated, smallpox was finally declared eradicated in 1980, saving approximately 40 million lives over the following 2 decades. There were several factors that made smallpox an ideal candidate for eradication. First, humans are essential to the smallpox life cycle, so breaking the chain of human-to-human transmission causes the virus to die out. In contrast, many other pathogens like Ebola or the bubonic plague can survive in animal carriers, while the bacteria that cause tetanus can even live in the soil. Secondly, individuals infected with smallpox displayed a characteristic rash, making them easy to identify, even without a lab test. The lack of such practical diagnostic tools for diseases with nonspecific symptoms or that have long incubation periods, such as AIDS, makes their eradication more difficult. Third, the availability of a smallpox vaccine that provided immunity for 5 to 10 years in a single dose meant that there was an effective intervention to stop the virus from spreading. And finally, the initial success of several countries in eliminating the disease within their borders served as a proof of principle for its eradication worldwide. Today, the same criteria are applied to determine whether other diseases can be similarly eliminated. And even though smallpox remains the only success story thus far, several other pathogens may be next in line. Great progress has been made towards eradicating guinea worm disease simply by use of water filters. And vaccination for polio, which previously disabled hundreds of thousands of people each year, is estimated to have prevented 13 million cases of paralysis and 650,000 deaths since 1988. With a 99% drop in infection since the eradication effort began, one final push is all that is needed to ensure that polio will never paralyze another child. Disease eradication is one public health effort that benefits all of humanity and challenges us to work together as a global community. Beyond eliminating specific diseases, eradication programs benefit local populations by improving health infrastructure. For example, Nigeria recently used facilities and personnel from their polio eradication program to effectively control an Ebola outbreak. Furthermore, globalization and international travel means that even a single infection anywhere in the world can potentially spread to other regions. By helping to protect others, we help to protect ourselves. Disease eradication is the ultimate gift we can give to everyone alive today, as well as all future generations of humanity.
Okay, so hopefully that gave you a really good introduction to how diseases are controlled and eradicated. So as I said, there's going to be, I think, 5 questions. So what I'll do, I'll go through the questions. If you write down the number and the answer that you think's right, they're all multiple choice. So the first one is, how does smallpox spread? So is it through food and water? Is it through face-to-face contact? Is it through fecal matter? Or is it through blood? Okay, so all the questions are going to appear first, so you don't need to worry about whether I'm going to suddenly reveal the answer to you. I'm just going to go on to the next question now. Question 2, smallpox is deadly in up to how many percent of cases? Is it 10%, 30%, 60%, or 90%? Question 3, which of the following diseases is impossible to eradicate? Is it tetanus, measles, guinea worm disease, or poliomyelitis or polio? Question 4. Guinea worm disease is nearly eradicated thanks to which effective intervention? Is it a vaccine? Is it mosquito nets? Is it antiviral medication? Or is it water filters? And lastly, question 5, which characteristic made smallpox an ideal candidate for eradication? Was it the fact that an effective vaccine existed? Was it the fact that humans are an essential part of the smallpox virus life cycle? Was it because cases displayed a characteristic rash? Or was it because several countries successfully eliminated the disease? Or was it all of the above? Okay, so you should have all your answers now. So I'm going to go through the correct answers with you so you can check what you've done. So smallpox spreads by face-to-face contact, okay, much like COVID-19. And you could see that in the video. You could see the droplets from people sneezing and talking. It's deadly in up to 30% of cases, so quite a very high ratio of people would die if they contracted smallpox. So very important to control and eradicate that one. It's tetanus, which is impossible to eradicate. And if you remember from the video, it said that it can exist in soil. And so that, you know, it can carry on existing even when you control the people who have got it. You can't control whether it's in the soil. So that's not an easy one to eradicate. Guinea worm disease is nearly eradicated thanks to water filters. And it was all of those characteristics that made smallpox an ideal candidate for eradication. Yes, there's an effective vaccine. Humans are the essential part of the smallpox virus life cycle. It had that characteristic rash, so it was really easy to tell when somebody was affected by it. So you knew that you had to vaccinate people that they were in contact with. And lots of countries had successfully eliminated the disease. So that showed that it was possible to eliminate it from all countries. It was just quite hard in some cases, and a lot of effort went into it. So really interesting look into eradicating disease, and smallpox so far the only one that has been successfully totally eradicated. Okay, so I'm going to tell you a little bit about how that links into the course, and I'm going to set you some other questions and then a task for you to do. So in the unit on diseases, you will study organisms that cause disease, and there are 5 different categories of those. So bacteria, viruses, fungi, protozoa, and macroparasites. And the pictures that you can see on the screen there, I've chosen a picture to represent each of those different types of organism. Okay, pathogen is the scientific word that means organisms that cause disease. But you might like to think, just reflect on those pictures and think about which one you think represents each of those different organisms. Okay, some of them more recognisable than others, particularly with the news at the moment. And you can also think about the diseases that were mentioned in the video. What type of organism is responsible for each of the diseases mentioned? So the ones that were mentioned were smallpox, Ebola, bubonic plague, tetanus, AIDS, guinea worm disease, and polio. Some of them you might know, some of them you'll probably have to look up, but it's worth having a look. You'll be learning a lot about those different organisms, about their structure, about their life cycle, about their size, and about how they cause infection. You'll also be learning about transmission routes. So that was touched upon in the video. There are lots of different transmission routes, and I've only selected a few of them to talk about here. But as you know, some diseases are transmitted by air droplets. Some are transmitted by food in various different ways. You can see in the pictures there, I've got a picture of a lovely buffet, and there aren't that many buffets at the moment because of how easy it is for diseases to be transmitted through food. There are sexually transmitted diseases, vector-borne diseases. So that's things like malaria, which is transmitted by mosquitoes, and the mosquito there would be the vector. And a vector is just something that carries a disease from one person to another. And diseases can be transmitted in blood. Okay, so again, what you can do is find out what the transmission route is for each of those diseases mentioned in the video. And you also learn about biological and drug defences. And this is a huge part of the unit, and I'm only going to really briefly touch on it here. But you'll learn about hygiene and other behavioural practices, which hopefully you know a lot about to start with anyway. You'll learn about non-specific defences that your body has. So what barriers are there to infection? That's things like the skin, things like the mucus that you have in your airways. It's things like the white blood cells that you have that called phagocytes, which basically destroy bacteria and viruses that get into you. And there's also something called the specific immune defense system, which is really quite complex. So we haven't got time to go into it in this little lesson today. But that's basically to do with antibodies and how antibodies are formed and how they help to help to prevent you from getting ill. And vaccination, which is linked to that specific immune defense system and the antibodies. But you'll learn exactly how vaccination works. And you'll also learn about drug treatment, so things like antibiotics and the problems that there are with antibiotic resistance, and also antiviral drugs, antifungal drugs, and things like that. So what I'd like you to do is to find out what vaccinations and drug treatments exist for each of the diseases that are mentioned in the video. And then your main task, what I'd like you to do is answer these 4 questions. So you can use information from the video, and you can also research online to find out more about these 4 questions. So how is the technique used in smallpox eradication similar to the technique used in the Ebola outbreak response? And what characteristic does smallpox and Ebola have in common? Secondly, what are some of the challenges of disease eradication programs? Thirdly, there have been efforts to eradicate malaria in the past. What makes this task difficult? And fourthly, and finally, do you think it will be possible to eradicate COVID-19? What characteristics of COVID-19 make you hopeful that this will happen or can happen? And what characteristics will make it challenging? And you might like to come up with an evaluation, so a conclusion given what gives you hope and what is going to be challenging. What is your conclusion about how possible it is? Okay, so hopefully that will give you an opportunity to do some research in preparation for the course that you're going to start doing in September. If you do want to take it further, so if you want to learn more about eradicating diseases, the video was a TED Ed video, and along with the lesson video on the college website, there should be a link that you can follow. But if the link is not there for any reason, I've put it on this slide. But the easiest way to get at it will be to follow the link on the college website. And that gives you more information. So there's a section with the video, with the TED Ed video, called Dig Deeper. And if you look at that section, there are lots of additional resources that you can explore to do with smallpox, to do with polio and how close that is to being eradicated, and to do with the guinea worm water filter system. Okay. So that's it from me. I'm really looking forward to seeing you in September, and I hope you're looking forward to starting the course. As I said before, make sure that you think about what your career aim is. So what do you want to go onto university to do, and make sure that you, when you enroll, that you enroll on the right course. So either nursing and midwifery or health and social care. Do the preparation work. So there should be a summer pre-work task on the college website that hopefully your attention's been drawn to. So do that, bring that along with you at the start, and also bring along your notes from today's lesson as well. It's really quite a challenging course, and it's really useful early on for me and your other teachers to get a feel for how to your skills when you start the course, so that we can help you to develop those skills as quickly as possible so that you can be successful, and as I said, get those lots of distinction grades right from the start. Okay, so the pre-work will really help us to be able to see what skills you have now and what skills maybe we need to start developing. Okay, so as I said, really looking forward to seeing you in September. So goodbye for now and have a good summer.